Hello everyone, today's talk is on chest clearance, and here we're going to be looking at ways in which we can help you to get rid of that stubborn mucus from your chest. So, why do we get mucus? Well, it's simple. Mucus is produced in the lungs as a part of the body's normal defense mechanism. It has two jobs or two main functions. The first is to stop the lungs from drying out, and secondly, it's there to catch any particles of dirt or dust that are missed by the filtration system in your nose. Tiny little hairs in the nose will filter out most of the dirt or dust from room air, but whatever gets missed goes down onto the chest and it sticks to the thin blanket layer of mucus that we've been talking about. From there, tiny little hairs that you can see on the diagram, called cilia, waft the mucus up to the back of your throat, where you can either cough it up and clear it from your chest, or you can swallow it. If you do swallow the mucus, it is important to remember that it won't harm you at all. This system can be damaged, however, by smoking and inflammatory conditions. These can affect the thickness of the mucus and the way the cilia move, which will ultimately make it more difficult for you to clear that rubbish from your chest and increase the likelihood of an infection setting in. So, how do we keep our chest clear? The first thing that we need to do to help keep our chest clear is prevent dehydration. It's really important to keep our fluid levels up and to offset the amount that we lose through sweating, coughing, and shortness of breath. If we don't drink fluids, our airways become dry and the mucus in them becomes more sticky and ultimately more difficult to clear. The government recommend that a moderately active person should drink at least 2 litres or 8 glasses of water or fluid per day. If you have a chest infection or if you struggle to take this much fluid on board, you may wish to humidify the air that you're breathing in. This can be done through steam inhalation, but be careful with hot water, or by having a hot shower and allowing the steam to go gently into the lungs as you breathe. It's also really important to reduce the caffeine intake, as caffeine is a diuretic and increases your need to use the toilet and ultimately makes you more dehydrated. Another great way of helping you to clear your chest is to exercise. This encourages deep breathing. We would always recommend that during an infection you try to maintain gentle exercise, but don't overdo it, and remember that fitness helps you be strong through illness. The best and most efficient way, however, of clearing our chest is through deep breathing exercises, or as we call them, the active cycle of breathing technique. This is the simplest, most efficient way of clearing secretions or mucus from your chest and will cause you no harm whatsoever. The first thing is we need to follow the cycle as shown on the diagram below. We start in the red section by controlling our breathing at a regular rate for about 20 to 30 seconds. After the 20 to 30 seconds, we move on to the 3 to 4 deep breaths in the orange section. Here, I would like you to take a big breath in as far as you possibly can and hold for a count of 1, 2, 3 before releasing that breath fully out. We do that a further 3 times before moving back to the breathing control in the yellow section. Here, we again regulate our breathing and settle the breathing down for 20 to 30 seconds before again moving on to another 3 to 4 of those deep breaths. Then we will relax and regather our breathing by doing some breathing control. And finally, what we will need to do, as shown in the purple box, is a huff. Now, a huff is what we would call a forced expiratory technique. It's as if we're trying to steam our glasses up by doing this very, very hard. A wide open mouth, a big breath in, and force the air out of your lungs. If we can, following that, we'll try a good strong cough. This should help to move the mucus up in the airways. But if we can't clear it, we can go through this cycle again and again as many times as it takes to actually clear that mucus. And as I've said previously, it will cause you no harm whatsoever. So, in summary, it's really important that when we're trying to keep our chest clear, we drink plenty of fluids. If the airways are particularly dry, we need to try steam inhalation. Make sure that we take our medications regularly as prescribed and keep as active as humanly possible. Do the breathing exercises every day to help remove that mucus from your chest most effectively. And finally, if you do struggle to get that rubbish up off your chest, seek advice and help from your physiotherapist, who may be able to give you other options in your chest clearance.